Hello, Namaste viewers. I'm Rainy and welcome to our channel PhysioHealer. Further to our last video that covered the details about mechanism of stroke, types and how to identify stroke, we are going to learn today what happens after brain stroke occur. This video is going to take you inside the perspectives of stroke survivor. It will help you to understand what our mind and body goes through after brain stroke, the changes that comes to our body such as paralysis, inability to understand meaning or do abstract thinking, and why such changes occur after stroke. This video will also guide you to understand what are the do's and don'ts for patients and caregivers after stroke and what you can do to get optimum recovery. This is the second video of stroke rehabilitation series. So if you have not seen our previous video, then please go through it before continuing with this one. I'm going to start with a case study first. As it was mentioned in the last video, that stroke is no longer an elderly condition and cases of young stroke are continuing to rise. So this case report is about a 26-year-old woman, let's call her Miss M, who was presented to the emergency department with sudden left-sided weakness and imbalance followed by reduced level of consciousness. After stabilizing Miss M, examination was done and it was found that she was unable to move left half of her body, having difficulty in speaking, and her left side of the face appeared to have drooped. After a few days, the relatives noticed that her paralyzed limbs were getting stiff and they are assuming certain attitudes while positioning. Miss M is unable to move her limbs voluntarily, but the limbs tend to move automatically whenever she yawns or sneezes. Now, before understanding what is happening to Miss M, it is essential to know that effects of stroke vary from person to person based on the type, severity, location of lesion and number of stroke episodes. The brain is very complex and each area of brain is responsible for specific function. The emergence of symptoms are based on area of the brain damaged from a stroke. A common disability that results from stroke is complete paralysis on one side of the body. It is called hemiplegia. A related disability that is not as debilitating as paralysis is one-sided weakness, also known as partial paralysis or hemiparesis. All of the body's voluntary movements are controlled by the brain. One of the brain areas most involved in controlling voluntary movement is the motor cortex. It is located in the rear portion of the frontal lobe. To carry out an action, your motor cortex must receive information from all other parts of brain, such as information about the body's position in space comes from parietal lobe. Information about the goal to be attained for a specific task and the specific strategy for attaining that goal comes from anterior frontal lobe, and the memories of past experience of strategies used to complete the similar task comes from temporal lobe. Immediately after stroke, all the connections of the brain get disturbed and become suppressed, leading to complete paralysis or weakness to side of the body opposite to the injured hemisphere of brain. The CT angiography done on Miss M showed a right middle cerebral artery occlusion, resulting in left side paralysis of her body and face. A pioneer of physiotherapy, Signe Brunstrom, had stated that when the central nervous system is injured, as in stroke, an individual goes through an evolution in reverse. Movement becomes primitive, reflexive and automatic, similar to a newborn child. Thus, although Miss M had lost voluntary control of her limbs, they had moved automatically along with other involuntary movements such as yawning or sneezing. When paralysis first set in, moving a paralyzed part is difficult, but with development of automatic and reflexive movement, some tone starts to generate on the paralyzed muscle. Tone can be defined traditionally as the tension in the relaxed muscle. Generally, tone is the readiness of the muscle to produce action. It is the constant muscular activity that is necessary as a background to actual movement in order to maintain the basic attitude of the body, particularly against the force of gravity. So it is because of the tone that our body can attain erect posture while standing and attend to various tasks smoothly. If the brain stroke does not get proper treatment on time, the tone of muscle increases beyond normal and spasticity occurs. Spasticity is a motor disorder characterized by a velocity dependent increase in toning stretch reflex, exaggerated tendon jerks resulting from hyperexcitability of stretch reflex. So, whenever a patient tries to put effort to make a movement, tone increases. This change in tone and the presence of reflex is considered as a normal process of recovery. In such situation, patients will be able to move their limbs to some extent, but it in a repetitive or a stereotyped manner. Patient will be able to exhibit only a few stereotypic movement patterns known as basic limb synergies. Although increase in tone and synergy patterns are signs of normal recovery process from stroke, persistence of these signs for longer period of time will result in loss of independent joint control and produce long-term disability. These disabilities can be of different degree, mild, moderate or severe. They can be in different areas such as face, trunk, upper limb and lower limb. Tonal abnormality may lead to a learned non-use of limbs resulting in immobility and chronic pain. Patient with stroke will have difficulty in using their arm and hand for grasping, eating, dressing and writing. They may lose the normal pattern of walking and have difficulty in maintaining balance while walking. Secondary injuries due to fall after losing balance is a common complication after stroke. Optimizing tone and breaking the abnormal synergy pattern to regain normal pattern of movement has been the key challenge for physiotherapists in post-stroke rehabilitation, and it can be achieved effectively with timely action and cooperation from patient, caregiver and the medical team. Apart from movement difficulty and imbalance, stroke affects cognitive domain, which includes attention, memory, language and orientation. The most affected domains are attention and executive functions such as judgment, problem solving, and abstract thinking. A stroke victim may unlikely to tell you how to survive from a building on fire or how to make a cup of tea or solve a simple mathematical questions, and they are unable to shift from one task to the other. The patient with one or more cognitive impairment will appear confused and they may cry or laugh uncontrollably due to emotional lability. Starting rehabilitation as soon as possible after the cause of the stroke is treated is vital in stroke recovery. Studies have shown that initiation of physiotherapy strategies within first 2 weeks after the stroke declared as medically stable is beneficial. The road to recovery after stroke is long, but fortunately, the brain is capable of forming new connections and heal itself through the process of neuroplasticity. There are few laws of physiotherapy. One of them is never give up because we will never let you. Physiotherapy started early can do wonders because recovery is fastest within first 3 months of stroke, and your physiotherapist will guide you through the right way of doing movements and teach you what to expect next. There are few do's and don'ts for caregivers as well. A paralyzed limb must be handled and positioned carefully by the caregivers of patient to avoid undue injury. Avoid deep, vigorous massage of the paralyzed muscles as there is a high risk of second stroke occurring within the first month of onset of first stroke. And in later stages, deep tissue massage can increase spasticity, resulting in contracture. A caregiver must take care of their own health as well. Caring for a disabled patient is a positive feeling, but it can be challenging and overwhelming. Caregivers must ask for help whenever needed and educate themselves about the condition and learn correct ergonomic to lift a patient. They must also learn the correct method to dress a patient, how to feed them, how to attend bathing and toilet activities, and how to do bed mobility. Your physiotherapist can help you with that. If you have any question or suggestion about today's video, then please write on the comment section. If you have liked today's video, then don't forget to like, share and subscribe. See you next time. Bye-bye.